Hi, welcome today. This is the video 2 for lab practical for KINS 358. For mine, I have forward head plank. A description of the injury. It is defined as hyperextension of the upper cervical vertebrae and forward translation of the cervical vertebrae. This can lead to a painful shortening of the muscles of the back of the neck, as well as compression of the cervical vertebrae. Which is the uppermost portion of the spine that supports the head and protects the spinal cord. It also leads to forward head translation and rounding of the shoulders in most individuals. Our first assessment that we will go over is static posture assessment. In static posture assessment for forward head plank, we need to look for upper cross postural distortion syndrome. This is characterized by a rounding of the shoulders and forward head translation. This position can place large stresses on the muscles and connective tissue associated with the cervical spine and leading to other injuries. The second assessment that we will go through is transitional movement assessment for forward head plank. For this, we will use overhead squats. For overhead squats, we're going to look for the lower cervical spine may become flexed and the neck hyperextends to keep eyes level. This causes overactivation of the sternocleidomastoid mastoid. You will probably see upper body lean because of reduction activation of the upper back muscles and neck muscles. The next assessment that we will do for forward head lean or forward head plank would be the dynamic movement assessment. For this, we would just use someone walking on a treadmill or just walking on a court somewhere for little whiles just to see where their head is. We're going to be looking for, once again, the forward head translation and the rounding of the shoulders. The next assessment is the range of motion assessment for forward head plank. We will be looking for range of motions in the X, the Y, and the Z planes for the cervical spine. This will be done by testing flexion, extension, rotation, lateral flexion, and translation of the cervical spine. The next assessment that we will go through is MMT, or a strength assessment for forward head plank. For forward head plank, usually you want to have this done by a qualified licensed professional, which I'm not. But for this, I would test posterior and anterior translation of the cervical spine through overactive muscles would include the sternocleidomastoid, the levator scapulae, scalenes, upper trap, and suboccipitals. Some underactivated muscles would be the deep cervical flexors, the cervical erector spinae, the lower trap, and the rhomboids. The next part of our assessments will be demonstrated by me. The first part is the inhibit portion of the assessment. We're in the inhibit portion, we're going to use self-myofascial release on the sternocleidomastoid. We're going to be doing this by using 2 fingers on the sternocleidomastoid, rubbing it up and down from the origin, which is the manubrium and the sternum, of the sternum and the clavicle, and the insertion, which is the mastoid process of the temporal bone of the skull. The next portion of the assessment is lengthening of the muscle. We're going to stretch the levator scap. for 30 seconds and hold that stretch. The levator scap is a skeletal muscle situated on the back and the sides of the neck. The levator scap originates from the posterior tubercle of the transverse process of the cervical vertebrae, 1 to 4, and is inserted into the medial border of the scapula, extending from the superior angle to junction of spine and medial border of the scapula. You can do this stretch by trying to pull your forehead towards your armpit. We want to stretch this muscle because with forward head plank, this muscle is tight and needs to be loosened. The next part of our assessment is the activation portion. For this, we're going to be strengthening the lower trap by doing prone floor scapation, and we're going to do 10 to 15 reps with 2-second isometric holds, which is two-second holds at the top of the contraction, and then 4-second eccentric contractions, which is doing 4 seconds down from the end of the contraction. The lower trap is the muscle that is proposed to play an important role in ideal scapular mechanics. This muscle originates on the spine and extends from T2 to T12 and it inserts onto the spine of the scapula from the acromion process to its root. Activation needs to happen to this muscle because it is underactivated and weak in individuals with forward head plank. The last portion of the assessment is the integration portion. This will happen at the end of everything with clients and individuals that hopefully will see improvements within the muscles of the cervical spine. With cervical retraction with the exercise ball and doing T positions is what we're going to be doing for the integration portion. This will be done for 10 to 15 reps and done under control. The exercise will be done for cervical spine impairments to integrate the use of cervical spine musculature and the shoulder musculature.